Hi Enid, I am Diana coming to you from Garfield County Health Department, and welcome to another community health update. So let's jump right on in. From the Oklahoma State Department of Health, what you need to know: on August 15th, the OSDH reports first human cases of West Nile virus in the state for 2023. As mosquito surveillance pools across the state tests positive for West Nile virus activity. The Oklahoma State Department of Health is reporting the first human infections in 2023 caused by West Nile virus. Over the last month, evidence of West Nile virus activity has increased across the state and is now considered to be widespread. Positive mosquito pools have been identified in many regions of the state, and human infections have occurred in central, southeast Oklahoma. West Nile virus spreads through the bite of an infected mosquito in Oklahoma and is primarily spread by the Cyclux mosquito, which feeds on infected birds and then spreads the virus when biting humans, horses, and some other mammals. This type of mosquito increases in abundance during mid to late summer when temperatures are high and the weather pattern is dry. We expect human cases of West Nile virus every year, said Julianne Stone, the state epidemiologist. Typically, summertime is the beginning of the West Nile virus season in Oklahoma. So with more people participating in outdoor activities, there are increased opportunities for encountering infected mosquitoes. OSDH officials are reminding the public to take precautions to prevent mosquito bites as mosquito surveillance pools in the state show continued West Nile virus activity. Tips to avoid mosquito bites and prevent West Nile virus: use an insect repellent containing DEET, picaridin, or IR 3535 on exposed skin and clothing when going outdoors, particularly between dusk and dawn when mosquitoes are more likely to bite. Insect repellent with permethrin should be used on clothing only. Repair or install window and door screens to keep mosquitoes out of the home. Prevent items such as buckets, cans, pool covers, flower pots, children's toys, and tires from holding water to prevent providing mosquitoes a place to breed. Empty pets' outdoor water bowls and refill daily. Scrub and refill bird baths every 3 days. Clean leaves and debris from rain gutters regularly to ensure they are not clogged. While the vast majority of individuals with West Nile virus will likely never experience symptoms following an infection, those with symptoms are often mild and may include sudden fever, headache, and body and joint pain. Recovery typically occurs within 1 to 3 weeks. People older than 50 years, diabetics, or those experiencing uncontrolled hypertension are at a greater risk of developing severe neurologic disease from West Nile virus infection. When the disease affects the nervous system, it can cause confusion or disorientation, loss of consciousness, paralysis, neck stiffness, or coma. Long-lasting complications of West Nile virus disease can include difficulty concentrating, migraines. For more information, go to oklahoma.gov and search West Nile virus. And from the Garfield County Health Department, we have programs and services worth bragging about, if I may say. We have the Pediatric Audiology program for ages birth to 18. We do not require any referrals. You can call Monday through Friday during clinic hours, and we will be happy to get you scheduled. And we have Center Start for up to age 3, also no referral required. And this program helps to identify any milestones that need further evaluation or help alleviate any concerns for parents or questions that they may have on the milestones for their child. We also have Children First, designed for first-time moms. And we have WIC, a food supplemental program and a big advocate for breastfeeding. And for this particular program, we are launching our program that has been dormant for the last 3 years, our breastfeeding support group tomorrow, which is August the 29th. And if you have any questions or you're part of a WIC participant hearing this right now, please reach out to us at 580-233-0650. We'd be happy to loop you in. You should have received a letter in the mail, but if you didn't, I'd happy to connect you to the WIC team so we can get you on board and more details with that. And that is it for this community health update. Find us on Facebook, connect with us, and share our page. Follow us, and until next time, stay cool and stay safe. Bye.